Recent statistics indicate that about 1 in 166 children will be diagnosed as autistic. Autism has been described as being what someone is rather than what someone has. Is it a disability with a specific external cause and therefore a specific medical cure? Or is it a condition that someone is born with and is therefore a lifelong disability? If it is the latter, what do we know about autism today that can help the autistic person better cope with this affliction? Today's guest will help us to understand this complex and multifaceted condition. Hello, my name is Richard Lucan, and I will be your host today for this edition of The Better Part. Stay tuned.
Welcome to The Better Part, a program by and for seniors and devoted to exploring the many facets of those better years of our lives. The name of our program was inspired by a quotation from Robert Browning. "Grow old along with me, the best is yet to be, the last of life for which the first was made."
We're delighted to have with us today in the studio Lisa Sanchez for the second time. Lisa's first program with The Better Part concerned the subject of speech therapy. Lisa has a master's degree from San Jose State in speech pathology and is currently employed at the Spectrum School of San Jose, California. This school serves students with challenging educational and behavioral needs, such as those who are autistic. Lisa, tell us exactly what autism is.
Autism is a part of a spectrum of disorders, and it is a childhood disorder of severe developmental delays. And actually, children that are diagnosed with autism have a severe inability to react with the world around them and have an abnormal absorption of themselves.
How do they interact with other people?
Well, their interactions with other people are marked with severe communication disorders, so it takes a lot of therapy and intervention for them to interact with other people.
And how can you diagnose when a child is autistic?
Well, most children are diagnosed with autism before they are 3, and normally what happens is a child will develop up into a certain point, and at that point will regress. So a child may learn to walk on time, will babble up to a certain time, and instead of the babbling turning into words, the child will continue to babble. And it's at that time the parent or a caregiver will be alerted that something is wrong. And so the child is then taken to the doctor, the psychiatrist, or another healthcare professional. At that time, whatever professional is involved will ask for the child to be thoroughly evaluated. And at that time, they'll be diagnosed with autism or autism spectrum disorder.
Give us a little bit of a history of where autism came from and how it was discovered.
Sure. In 1911, a Swiss psychologist by the name of Eugene Bleuler coined the term autism when describing his adult patients that had schizophrenia. In 1943, Dr. Leo Kanner from Johns Hopkins University actually described autism for the first time, and he based his descriptions on 11 children to adults that he had been observing from the years of 1938 to 1943. And he used the word autism to describe what he studied in these children that were withdrawing from human contact. And the earliest one he used was a 1-year-old that he had been observing. So he was the first to really describe what autism was. During the 1940s through the 1960s, the medical community really used the word schizophrenic and schizophrenia instead of autism, which really misled parents and misled the community, the autism community. And because of this lack of understanding, it led parents to believe that their children's difficulties were somewhat their fault.
Ah, yes, I've heard of that. And what exactly is autism spectrum disorder? That's something I've heard before.
Yes, autism is a part of a spectrum of disorders. And for today's purposes, I broke up autism into 4 different sections. The first being Asperger's syndrome, the second being pervasive developmental disorder, or PDD, the third being high functioning autism, and the fourth being Rett syndrome. And the first I'll talk about is Asperger's syndrome, and that's been more in the news and people are more familiar with that term. And it's the milder form of autism where children tend to isolate themselves socially and are somewhat egocentric. They have difficulty with verbal communication and have interests that are very channeled. It's very hard to get them to have interest in other things. For example, they'll be very obsessed or compulsed to do video games, repetitive behavior over and over and over again. So it's very difficult if there's not early intervention to get these children to interact with two-way communication between another communicator. This lack of responsiveness of these children may be accompanied by the inability to communicate appropriately. So they may point to what they want, or they may use hand gestures, or they may be echolalic, which means if you say, "Give me the book," they'll say, "Give me the book," instead of giving the book or giving an appropriate response.
Yeah.
They're echolalic, which means they'll repeat the same phrase. What's interesting about Asperger's syndrome is that they will tend to, if having early intervention, they can have some normal language skills that can be taught to them since it's milder, meaning that it's not, their behaviors are not as involved as the other sets of children with autism. So the next one is pervasive developmental disorder, not otherwise specified, which is short, we would call it PDD. And this child has autism but doesn't meet the criteria for all of the symptoms in the diagnostic manual, the DSM-4. So if you have to have 12 of those criteria, PDD would have 6. In high functioning autism, this child has autism but has normal learning and normal cognitive functioning and learning skills. So language development may be difficult at first, but as they become more proficient, their language will become proficient eventually. Rett syndrome is the last type of autism that I'll talk about, and it affects females only and is extremely rare. And how it's diagnosed is the child will have hand wringing that's so disruptive that the parent will bring the daughter to the doctor and say, "My child's doing this odd behavior with her hands." And at that time, the child will be diagnosed. And it's very rare. 1 in 100,000 children will be diagnosed with Rett syndrome. These children develop the criteria for autism as well. And I just wanted to point out, if I hadn't said before, that males are more likely to have autism 4 times to 1 than females.
How can you treat autism? What do you do to treat this?
Well, the Autism Society recognizes the importance for early intervention. And that means that as soon as a child has been diagnosed, or as soon as they are showing symptoms of autism, they get help as soon as possible. They would like a curriculum for these children that addresses specific areas of need, focusing on long-term outcomes, and considers the development level of each child. Although these children have the same label as autism, they're developing at different levels. So the Autism Society of America really wants to make sure that each child's curriculum for language and for other areas of deficits really is personalized to them. So each of them has a different, like we would say, curriculum. We want to focus on generalization, meaning if we teach something to a child during a home visit or at school, they're able to generalize it into the community. For example, if we teach them to get a cup and get water in school, they'll be able to do that anywhere there's a cup and water. They'll be able to do that. So it's a carryover and generalization of those skills. We really want to push for these children to get help from 0 to 3. So if we can really zone in and help children, even babies that we're noticing has lack of interaction with their parents or caregivers. There's also use of technology that we use with children with autism. And I just wanted to thank you again for, in the beginning, saying that children have autism. They're not autistic. We're very keen to say that in our world of therapy, that the child has autism. So it's the child that has a disorder, that the disorder isn't the child.
So it's really a lifetime situation.
It is, it is. There's no known cure, and I'll say that throughout the interview today, but there is no known cure as of yet. And again, back to early intervention, we really want to have the family involved and make sure that all of the coordination of the therapists and the doctors and the teachers is really intact, and it's a main component of the child's learning and curriculum.
Does this have anything to do with applied verbal behavior, or?
Yes, there are different types of therapies for children, and one of them is applied behavioral analysis, which is ABA, and that's paired with the treatment of children with autism. It's not a new procedure. It's been scientifically done and studied for over 50 years, and we use ABA to reduce some of the disruptive behaviors that children with autism have. In addition to that treatment, there are hundreds upon hundreds of treatments out there that parents have used, that people are saying works, people that are saying don't work. If you plug in, autism treatment into the computer, you'll be looking for days. So I really wanted to concentrate on the ones that we use, the ones that I use, one being ABA, applied behavior analysis, so really training the child to not do the disruptive behaviors. And then discrete child training, which is teaching the child and reinforcing the child. For example, if the child really loves Cheetos, he has to, put the cup in the sink and then he'll get a Cheeto. So it's really training the child to do what you want them to do, and then reinforcing it with something that's highly reinforceable, like the Cheeto.
Do you have a lot of success with this sort of focus?
Oh, yes. For some reason, children with autism have very specific food likings, and they like crunchy things. So Cheetos is one of them, Doritos, candy. They have food sensitivities, so they really get involved with one type of food that they like. So if you can get it and use it to your advantage, then it is highly successful. Unfortunately, they tend to be the sweeter or the junkier foods, so we try to limit that because you can't really carry that over into the environment. If you want them to do something out in the environment, they're not always going to have a Cheeto or a Dorito to be reinforced. So we do try to limit that and then try to fade away that reinforcer.
Phase it out.
Yeah. There's dietary interventions, and some parents really believe that a gluten-free and casein-free diet really helps reduce the behaviors in their children. We don't know this scientifically, and there's nothing scientifically studied to say that this really does work, but there are some parents that live by it and have found some success. And a lot of children with autism require feeding therapy because of their oral sensitivities. And again, they like specific foods that tend to be junkier foods, chips, chocolate, stuff like that. And unfortunately, if these habits aren't interrupted at an early age, you'll get tooth decay and malnutrition, and some even have to go on feeding tubes.
What about this picture exchange communication? What is that?
Well, so some children and a lot of children with autism are nonverbal. So instead of them responding to you verbally, they'll have a picture of what they want, like a picture of Cheetos.
Oh, yeah.
So we'll use the Cheeto example. They'll give you a picture of the Cheeto and then you give them a Cheeto. So it's exchanging verbal or exchanging communication that's not verbal. Or it's a picture of the bathroom. They'll give you the picture of the bathroom. That means they need to go to the restroom. Or a picture of a glass of water. They give it to you. Or if they don't give it to you, they can point to it. And so that's the exchange of, it's called PECS, picture exchange communication. And we use that in speech therapy and teach the family and everybody that's involved in the child's life to use this picture exchange system.
Can the autistic children be helped with drugs or pharmaceuticals?
That's a good question. Since there's no known cure, and we're not quite sure yet what causes autism, there's not a pill that can cure it or take it away, but there are pharmaceuticals that help with the symptoms of autism. It can help with the disruptive behavior. So yes, a lot of children are on medications to help them sleep, to help them with their aggressive behaviors, to help stimulate their appetites, to help with their obsessive compulsive disorders that are associated with the autism.
And in what ways does this early intervention, does it help the child's life?
Well, we know that the brain is forming at a very early age, and we know that the brain forms through our lifetime, but there's an optimum spectrum of time where it's important that these children get early intervention, because we know the brain is vastly learning tons of information, and we want to get them early before they've established habits that we're unable to get to. And so early intervention, again, we mean from 0 to 3, 0 to 6 years old. We really want them, like what we say is 40 hours a week of therapy.
Wow.
So it's really like a job for them.
And do you use a special curriculum in this program, or?
Well, there's special curriculums at schools for these children. Not all children with autism are mainstreamed into the main classes. A lot of them are in separate classes or separate schools, private schools, like the Spectrum school, like the one that I work at. These children can't be mainstreamed as of yet, but the goal is to mainstream them so that they're with their peers and that they have their peers as examples for normal behavior, normal language. I think that what you were asking. Okay.
Yeah, and I was wondering also about what is the family involvement in this training?
Well, the family is critical. Since I said that the idea is that the child get 40 hours of therapy, you can imagine that that's a full-time job for the child, but it's also a full-time job for the parents to sort of organize different therapists. The applied behavioral analysis therapist will come in 6 hours a day, then the speech therapist 1 hour a day, and then if they need occupational therapy for anything, for fine motor problems that they might have, and then physical therapists if they have gross motor problems. It's definitely an involved science to their therapy, and so the parents have to be involved. And once we're gone and out of the picture, it's really the family's opportunity to use what we've taught them to teach them, to use our therapy and then do their own therapy when we're gone out of the home.
So what is some of the ways that a parent or teacher will communicate with an autistic child?
Well, some autistic children or children with autism will be verbal. Verbal meaning from grunting all the way up to phrases or sentences. So we can communicate with them verbally that way. And then it goes all the way down to nonverbal. And at that point, we would use the picture exchange system or a pointing system where the child points.
And what success has your school and other programs had in integrating these autistic children into the school system, and how are they accepted once they get in the school system?
That's a great question. Some of the children started off in regular education and were diagnosed during their process of being in regular education, so they were taken out of the regular education and put in special classes or special schools. The whole idea is to get them back into that regular education. So our curriculum is focused on getting them back to general education, and the success rate is great. I'm not sure of the statistics right now. I can find out that for you, but the children want to go back to regular education, and sometimes, the children in regular ed aren't as nice as they could be and are not as accepting, but for the most part, the teachers are great in accepting the children back and really try to mainstream these children, because in this country, the law is least restrictive environment for children that have special needs. And so the least restrictive would be regular education, and the most restrictive would be a private class and private school. So it's always going to be the push to have the child in a regular education setting and then pull them out for their therapies.
And do the parents have opportunities to get some relief from dealing with their children, or they pretty much, is there after-school programs or other programs for the parents to participate in with the children?
There are some programs. There's programs through the city for activities. A lot of these kids live in group homes because their behaviors are so disruptive to the families can't really handle them. So there are those kids that live in group homes. And if they're hooked up with their communities, there are some communities that offer respite a couple hours a week. But for the most part, these families have this child that is involved in their families and requires a lot of work. Unfortunately, there's a large divorce rate amongst families with children with these severe developmental disorders.
And how does your school, Spectrum School, work with the children? How much time do you spend with them, and what sort of things have you been successful at in your school?
Well, since I'm the speech therapist, I'm not in the classroom with them all day, but they do have a 1 to 3 adult student ratio, which is really, really great. So they're in school all day, and I'll see them individually for an hour.
What do you do during the hour?
Well, it's a good question. I do push-in, which means I go into the class and I work with them in the class. I don't pull them out. And I do that because my philosophy is that they should be able to work amongst their peers. And they need examples of their peers. And their peers can come over and help us. For example, we'll do a cooking class where we'll make Jell-O or pudding, which is very easy. You open up the box, you put the pudding mix in, and you put the milk, and you stir it. But that's a whole set of directions and lots of stuff going on language-wise that's hard for these children. But the other children are seeing it, they're coming over and helping. And so it's a push-in model. So I do see the children inside their classes. I don't take them out.
And do children have difficulty forming words or with the actual articulation of speech? Do you help them with that as well, and how do you do that?
I do with the smaller children, but the children as they get older, they've already established their speech pattern. So it's more important that they communicate, not how they communicate. So just that they're communicating with others around them.
So what are some of with the smaller children, what are some of the techniques you use to actually get them to learn how to recognize words? Or?
Well, we do the picture exchange system very early on. And actually, some children grow out of the picture exchange system and learn to use verbal words. We can do sign language. That's the earliest first step, is to teach sign language.
How young can you do that?
Babies,
really?
10 months.
Really?
Yep.
That's impressive.
Yeah, really young. You'd be surprised. So we start with sign if they're nonverbal or non-communicative and go to one word. If they can say the one word, then we go to 2 words and 3 words, phrases, and then sentences.
And you've had pretty good success with that?
Yes, absolutely. 1 out of 166 children are born with this affliction, and males, again, are more likely to have it than females, 4 to 1. But there's no known cure for autism right now, and so it's really important that our communities get together and try to understand what autism is, and that we really push healthcare to really get in there and support monetarily autism and the spectrum disorders, because it's an affliction that's growing. There's many theories on why it's growing. And another little piece of information to think about is it's growing exponentially in the Silicon Valley.
Really?
Yes, more than it is in the rest of the country or in the rest of the world. And so we really don't know why. And that's what's going on right now in the studies, is to find out why.
Well, Lisa, thank you very much for coming on the show. It's a fascinating subject that you talked to us about today, and I'm really glad you were able to come and share all this valuable information with us.
Thank you, Richard. I just wanted to thank you again. This is a great opportunity for the second time to come back and share with your audience and you autism and what an important subject it is. So thank you very much for having me. It's been a pleasure.
Thank you for joining us. We hope that you have found today's program both informative and interesting. If you would like to suggest a topic or a guest for The Better Part, you can always reach us at the Cupertino Senior Center. The number there is 408-777-3150. You can learn more about us and order a copy of this program or one of the many programs that we've done by visiting our website. The website address is www.thebetterpart.com. The Better Part has many of its programs available through the Santa Clara County Library System. And the Better Part has selected programs also on YouTube. Thanks again for watching. See you next week.